Thank you, Mr. Williams, and a pleasant good evening to all listening. This evening, I present the Health Emergency Operating Committee Situation Report for Wednesday, July 7th. The Federation of St. Kitts and Nevis continues its fight against the COVID-19 virus. Over the past 6 weeks, we have seen an increase of 472 confirmed cases, during which we have seen 273 persons recovered. There are currently 196 active cases, with 5 hospitalizations and 3 COVID-19 related deaths. This map gives an indication of the areas in St. Kitts most affected by this recent wave. It is important to note that the darker areas represent a higher incidence of cases and that these areas also correspond to the more densely populated areas on the island. Therefore, in summary, the Federation records a total of 517 confirmed cases of COVID-19, with 499 cases in St. Kitts and 18 cases in Nevis. 318 cases have fully recovered, and as mentioned previously, we now have 196 active cases, 5 hospitalizations, and 3 COVID-19 related deaths. The situation in Her Majesty's Prison continues to improve. A total of 55 inmates were impacted, of which 39 are now fully recovered. There are currently 16 active cases in the prison. The prison staff has also been affected. There were 12 confirmed cases among the staff. 2 have since recovered, and there are 10 active cases among the prison staff. The variant currently in circulation in the Federation is the Lambda variant, which was first identified in Peru and has since spread to 29 countries, most of which are the South American countries. Research is now confirming that this variant is more transmissible. Our contact tracing efforts continue. Thus far, 2,494 persons have been interviewed, 2,002 persons have been released from self-quarantine, and there are 492 persons remaining in self-quarantine. We also continue our COVID-19 testing on both suspected cases and their contacts. We are also engaging in targeted and random testing in various communities. The last batch of vaccines expired on Wednesday, 30th June, and brought the first phase of the vaccine program to an end. By end of day, June 30th, 69.4% of the target population had received their first dose, and 57.2% of the target population had received their second dose. The vaccination program continues tomorrow, Thursday, July 8th. Persons who have received their first dose, next slide please, of the vaccine between June 3rd and June 30th would have received a 12-week appointment. As stated before, the recommended interval between doses is 1 month or 4 weeks to 12 weeks. Therefore, persons can return for their second dose once 4 weeks or more have elapsed since receiving their first dose. Please note that the current batch of vaccines will expire on August 30th. We continue to encourage persons to adhere to the COVID-19 protective measures and behaviors, which includes sheltering in place during this lockdown period, wearing a face mask appropriately covering both your nose and your mouth, sanitizing your hands with soap and water and/or an alcohol-based hand sanitizer, maintaining a safe distance of 6 feet or more from persons with whom you interact, and boost your immune system by taking your vitamins regularly, eating healthy, exercising, and getting enough rest. We are all encouraged to work together, doing our part to reduce the impact of this disease. Remember, maintaining the overall health of the people of St. Kitts and Nevis continues to be our individual and collective responsibility. Stay safe, stay healthy. I thank you.